So good morning, everyone, and welcome to the fifth and final session of our Spectral Blue Autumn 2024 webinar series. Your cameras and your microphones are muted today, but please feel free to use the chat for questions. There will be a Q&A session in the end of the webinar, and I will then pick and read the questions from the chat. The presentations will be recorded and are made available for later viewing, as are also the four other webinars that we have had in this series this autumn. So let's have a look at today's agenda. So my name is Karin Henriksson. I'm the Global Sales Director here at Led Taylor and Spectral Blue, and I will be the moderator today. We will start the webinar with some welcome words from our CEO, Dr. Michelle Schmidt. After that, our senior scientist, Dr. Kirsi Saukkonen, will tell us about automatic infection control for healthcare. And in the end of the webinar, we will have time for questions and answers and discussions and some final words. And with this, I give over to you, Michelle.
Thank you, Karin, and a big welcome from my side also, and greetings from Finland. And some of you might actually don't know it, but we are located in the exact building that used to be the headquarters for Nokia mobile phones. So some of you might actually know where we are located. This autumn has been fantastic. We've had so many people calling into our webinars, so many questions, so many interactions. And this is the last of the series, but I do hope you will be very active. We will have a long question and answers after the sessions. And of course, you can always email us. You can always request another meeting where we can go through more details. But without further words, let me introduce our senior scientist, Kirsi Saukkonen.
So good morning, everybody. My name is Kirsi Saukkonen, and I am a specialist in clinical microbiology and have been working mainly on this hospital infection or healthcare infection era for 30 plus years now. And as mentioned many times, this is the last one of this webinar series today, but not the most or the least important one, because there are many issues in the healthcare that absolutely need some boosting with the hygiene systems. So here's the contents. We go through some customer problems, what are the healthcare related infections and why they are so important. Then data of the multi-wavelength visible blue light, the disinfecting blue light, and then last some customer examples. Healthcare associated infections, earlier they were called hospital infections, and but since the healthcare area is much more than hospitals, it's also the elderly care and dentistry, maybe even veterinary infections could be located in this area today, since animals are very important to us and we want to take good care of them. And what is a healthcare associated infection? It can be originated from many healthcare settings. And as you can see, there are many cases in Europe, even only in the acute care hospitals. Respiratory tract infections are the most common ones, and but the most expensive, and even that is a very big percentage, is the surgical site infections, and they are really loading the healthcare economically. Most common causes are the bacteria mentioned here, and the really big problem is the antimicrobial resistance microorganisms, which the percentages all over 30% of all these hospital-acquired infections. The average cost of these HAIs in Europe is more than 7 billion euros, and this consists of the longer hospital stay, additional hospital days in approximately 16 million per year, diagnostic tests to be done, additional nursing care, medication and dressing, and also readmission to hospitals. And this is only the economical advantage of the HAIs, but we can't forget about the human suffering and even direct deaths that are caused by these infections. How does the patient get an HIA? Mostly the infections are caused, or they are from the endogenous source. That means that they come from the patient self, or the patient's skin or internals, which get into the wound, or for example, and that the patient has been carrying this certain bacteria before, let's say, the operation and or the antibiotic treatment, and once you can get it into your wound, and you get maybe somehow immunosuppressed, so you can easily develop these infections. But then also the pathogens might come from the environment, the hands of the nursing staff and doctors, or the equipment infected can infect the patient. And also the surfaces are very important source of the hospital or the healthcare acquired infections. And it has been studied that up to 40% of these infections could be reduced by boosting the hygiene efforts. It has been said that, especially here in the developed countries that we live in, we have the industry gives us all the opportunity to take care of the healthcare acquired infections almost 100%. But the one thing that is lacking is the humane resources, so that we don't have enough people or to take care of the cleanliness of the environment, or then the timing for the cleaning process is so short that you absolutely are not able to get a good result. Some words about the antimicrobial resistance, which is one of the biggest healthcare problems today and also in future. And it is said that year 2050, we might be in a situation that we had 100 years ago, so that we don't have antimicrobial treatment that we could use for after the operations. The newborn mortality rises, and that is a really scaring threat. And antimicrobial resistance occurs when bacteria, viruses, fungi, and even some parasites change over time, and they have a longer response to the medicine or none at all. And this is taken very, very seriously today by the global health experts, and even many countries have that in their healthcare law, that this is one of the major issues that must be taken care of, and the leaders of the healthcare people are responsible for decreasing the amount of these antibiotic resistant bacteria. And then how we prevent this problem is, of course, that you have to ensure your hand hygiene. You have to ensure that your instruments and your environment are clean, disinfected, and sterile. The role of surface hygiene, though, so earlier, if we go that far back as the Florence Nightingale, so the rules were very strict. You had to have long enough space between the beds, even if the wards could have many people inside the same room. And they realized that the bed linen had to be clean, and the air clean enough, good food, and clean water. So those were the things that could at least to some extent decrease the infections. And then 70s and 80s, especially in US, so the healthcare deciders, so they told that the environmental hygiene is not important, so that it doesn't play an important role in the spread of healthcare acquired infections. But that heavily changed when we came to the new millennium, since there were so many studies of bacteria like norovirus and Clostridioides difficile that are surviving on the surfaces very long time, and they have the very good potential of infecting people through not so clean surfaces. And this is where the problem comes. The pathogens can survive on hospital surfaces for months. And this is not very often thought or even known. We kind of think that bacteria don't live on these inanimated surfaces for a long time. And then the other thing is that it's very, very difficult to fight against the invisible enemy. Bacteria we can't see. We can see the organic load or dirt on the surfaces, but we can't see the bacteria. But it's easy to think that once there is dirt, there is always bacteria, because they go hand in hand. And as you see, these bacteria can stay alive on these surfaces for several months. They don't necessarily multiply, but they do stay alive. And then after getting into the more or into the better environment for themselves, so then they start to multiply and cause the disease. And if you wonder these wide range of the survival time, like from 7 days to 7 months or 3 days to 5 months, so that depends on the fact that what kind of environment the bacteria or the virus is landing on. So that if they are in a very good environment for themselves, so they can last for very long times. And like, for example, the E. coli, so usually when it lands on a dry surface, so it doesn't stay alive more than a couple of hours. But if it stays in humid and moist environment, so it can stay alive for months. And then about the viruses, viruses usually stay very short times alive on inanimated surfaces, usually a couple of hours. But norovirus, of course, is an exception, so that it can stay even 7 days. Some studies show that they can the norovirus can be found from after 2 weeks on the certain surfaces. And but that is then quite exceptional virus. So, and it is also one of its methods to cause such intensive infections. And then also ambulances. Usually when we think of a hospital ward or the hospital environment, so it's kind of static, so that people are in certain places. They are either lying in their beds, personnel is running in the corridors and taking care of patients. But then on the other hand, so the ambulance is a very mobile problem in this bacterial world. So the work is very hectic. The ambulance could be in transportation for the whole day, maybe. It very seldom stays at the garage for a long period of time, and you never know what kind of patients you are transporting from one place to another place. The ambulance personnel, they do not know if this person have an infection of MRSA or Clostridium or something like that. It's much easier in the inside the hospital building, where you approximately know who has what infection in them. And then also cleaning the ambulance between the patients. It's difficult because sometimes they are such in a hurry so that they don't have the time to do it. And then also when you take the car to the garage, so the end cleaning of the car, depending on the time factor, could be very limited. And the current disinfection methods are mainly done by the chemicals and with the manual wiping. So we are using, well, in Europe mostly chlorine, alcohol, hydrogen peroxide, and then quaternary ammonium compounds for the chemical disinfection. These are all quite good antimicrobials, and but they, of course, when you have to do the manual cleaning and disinfecting, so it's a very high daily workload, and the performance is affected by a human factor, which means that each and every one of us we have our own way of wiping and cleaning surfaces. The chemical residue that these chemicals leave on the surfaces can form this so-called dry biofilm, which bacteria can use as food and shelter. And of course, today we have to think about the environmental friendliness and the chemical safety documentation is very important. And the one very important thing is the exposure that causes for the personnel that causes health and safety risks. And this is quite well documented also in several scientific researches. Then the other one is ultraviolet radiation. It's very quick disinfection method and wide range antimicrobial, but it's very dangerous to people, and the rooms must be always vacated when doing this disinfection. It also damages polymeric materials, makes them yellow, and they can even crack during the time. And some of the old generation lamps generate ozone and increase the particle emission in indoor air. And of course, those also needs staff training, like all the other methods. Then hydrogen peroxide fogging is quite usual, especially here in Finland. Many healthcare premises uses these smaller hydrogen peroxide equipment. The room must be vacated, of course, sometimes sealed if we use higher concentrations of hydrogen peroxide, and also after the disinfection period, you have to ventilate the room and be sure that the hydrogen peroxide levels are low enough so that the patients are safe to go into the room, and also the personnel. And then a lot of problems, of course, are caused by biofilms. And biofilm is a layer of bacteria that are usually attached on surfaces. I earlier mentioned this dry biofilm. The most common biofilm is always usually on the areas where there is moisture or water. And I'm not going to go very deep into this biofilm issue, but the important thing is that especially when you are using chemical disinfection, the biofilms prevent the disinfectants to work properly. If you have a very hard biofilm problem, you might need 30,000 ppms, parts per million, chlorine to get rid of the biofilm, while the usual disinfection concentration of chlorine on the cleaner surfaces is approximately 500 to 1000 ppms. So it is a very it very efficiently blocks the disinfectants. And then the automated and continuous blue light disinfection, that is the main topic of today. Here you can see some of the spectral blue disinfection devices. They can be fixed installations to the ceiling and look like very normal room lights, or then they can be these portable and plug and play devices that you can install very easily on your premises. This patented multi-wavelength high intensity visible blue light that Spectral Blue is very efficient killer of microbes on surfaces and also in air. And it kills all bacteria, including multi-resistant strains, molds, yeast, lipid enveloped viruses such as coronavirus and influenza virus. When we talk about protein enveloped viruses, for example, adenovirus and norovirus, or bacterial spores, so they require more or higher intensity and longer exposure times than all the earlier mentioned microbes. This method is touch-free, it's sustainable and safe for people and materials. And it has a long lifetime without maintenance, calculated approximately 50,000 hours. And the quite special thing is also that it can break biofilms and it can penetrate liquids, which it's quite unique if you compare it to the disinfectants that are usually weakened by the biofilms, and also UVC is not an efficient biofilm destructor. And here you can see some examples. I often get this question that where can you use blue light? And I usually turn it around, and because it's easier to answer where not to use it. Blue light can be used almost everywhere, but of course it's mostly effective in the areas where you can use it for the longer periods of time. Even if it's not dangerous to human cells, eyes, or mucous membranes, so the intensity of the light is quite blue, as you see, and it's not it's not very nice to work in that kind of area. Some ambulance people that I have spoken to say that some patients can feel that the blue light in the ambulance cabin is quite tranquil, so that it's calming. It kind of causes a calming effect, but usually it's not used when you have the patient in transport. And there are several or thousands of articles that have been scientific articles that have been studied multi-wavelength and even the single wavelength blue light research. But I'm going to present these three studies that are done with our spectral blue method. So first there is Harvard Medical School that checked the different wavelengths against the clinical methicillin-resistant Staphylococcus aureus. Then the University Clinic of Bonn, it's a European reference lab, and it tested the efficacy of several reference pathogens, which they were Staphylococcus, E. coli, Salmonella, and Candida species. And then also University of Helsinki, a leading virus lab, tested the efficacy of coronavirus and the blue light. So here you can see the Harvard Medical School experiment, and the curves clearly show that the multi-wavelength using 405 nanometers and 460 nanometers is the most effective combination compared to the single wavelength 405, which is quite commonly used also globally. Then the University Clinic of Bonn test results. Here are the several bacterial strains, and you can see the timeline of the killing and the efficacy percentages, and that is usually approximately from 2 to 4 logarithms if you put them in the logarithmic scale. And the most radical reduction, depending on the bacteria, you get between 1 to 4 hours with this intensity tested. And then the University of Helsinki coronavirus test. So the treatment with blue light led to significant decrease of the amount of infectious coronaviruses on the plastic surface. And the 90% reduction was already got or achieved in 15 minutes. And then the idea of the continuous disinfection. This is kind of a new way of thinking. The traditional disinfection means that you take a wipe and you moisten it with disinfectant. You wipe the surface thoroughly, and you can very quickly, in minutes, decrease the bacterial or the microbe loads on the surfaces. But what then happens is that the microbial, the microbes start to grow again. And usually that happens after, let's say, approximately 2 to 3 hours. And this is the same effect that happens also on your skin when you do your hand disinfection. So that in a couple of hours, so the skin has achieved the starting point with the microbes that was in the beginning of or before the disinfection. But the automated disinfection with the blue light works differently, so that you put the light blue bars on this picture are the periods that the blue light is on, and then the white bars is the period that the blue light is shut off. And as you see that it takes a bit longer, if you the reduction of the bacteria takes a bit longer than with the wiping, maybe 2 hours. And well, that's the average, but you can, of course, depending on the light intensity and the room, so it could start already from the 30 minutes. But it goes down. Then you have the period where you shut the lamp. The bacteria starts to go, or they start to grow. Then for a while you put the lamp on again. The bacteria go down, and this goes on and on. And with this method, so we can achieve the state that the high microbial count is never kind of back again, so that it stays on a low level all the time. And this we have also shown quite well in real life with when we have experimented, for example, clean rooms and clean room environments. So it really works. And then there was this one very good kind of an experiment. So Spectral Blue, we took part in a EU-funded urban tech project in 2 years, and actually did quite well in that project. I think that our project manager Tuukka even got to the podium with our results. And the blue light was used in a Santaros clinic, University Hospital in Vilnius, and the test was performed at the nephrology clinic, and in a room where patients were prepped for the dialysis. So that the patients came into this room and they got the IV catheters and stuff like that. And the room was equipped with the Berlin plug and play devices, and then the samples were taken always. They usually, because the room was used during the day all the time, so the lamps were on during the nights, and the surface samples were taken from several places before and after deploying the blue light. Usually the samples were taken in the morning. And the results were very nice, so that the yellow bars are before using the blue light and blue bars after the blue light. And you can see the very distinct decrease in the bacterial amounts on the surfaces. And then these, even if there are thousands of these kind of an antimicrobial studies done in the world, so that where people have studied if the microbes are killed on the surfaces by blue light. So these so-called efficacy studies are not that frequent yet. And that depends on the fact that since the method is quite new, efficacy studies, they mean that you follow the efficacy of a new methods to decrease the amount of diseases, not the decrease of microbes on the surfaces, but really if it's effective against the diseases that you want to get rid of in the healthcare. And these efficacy studies usually take from 1 to 2 years, so they last very long, and they are very, very expensive. So we are talking about hundreds of thousands of dollars or euros that they cost. But there is one case studies from US, and they followed an orthopedic operation room 1 year before the blue light, and then 1 year after installing the blue lights. And of course, the bacteria on the surfaces with the blue light decreased in this study more than 80% on the surfaces, but also during the year they got the reduction of the surgical site infections from 11 cases to 3 cases. And this might sound quite a small decrease, but in fact, if you turn these surgical site infections and their treatment into money, so it's a very, very big amount of money, so it's really expensive. But I think that in near future, so we are getting more of these case studies. So, and the benefits why customers should choose Spectral Blue, they want to think of their employees and the materials in their premises, being a chemical-free method and a UV-free method is one of the very most important things. It's automatic and continuous, always the same disinfection result. So where the light hits, so it 100% disinfects the area always the same way. And it also can eliminate the biofilm if that is the problem. And then it's economical and effortless, so it's maintenance free, and you don't have to use the chemicals, or you can reduce the use of the chemicals at your premises. Of course, you must remember that automated disinfection methods like UVC, blue light, or fogging with hydrogen peroxide, they never clean your surfaces, but they disinfect your surfaces. And where you can, as I mentioned, that it's easier to say where you can't use blue light. So still there are these certain areas that are available for using blue light. For example, isolation patient rooms can be disinfected with these shared toilets, ambulances. I have highlighted the staff's break rooms, because usually those are the places where microbiologists at least finds bacteria on hospital surfaces, if not any other place. And then the doctors and nurses' appointment rooms are important also, since many people are taken in during the day, and usually the cleaning between the patients, it should be done by the doctor or the nurse themselves. And then also of course the high hygiene areas like hospital pharmacies, medicine distribution, instrument maintenance facilities, labs, operating rooms, and sterile supply storages. And this is one of my favorite pictures. It's said by Dr. Weinstein a long time ago that given the choice of improving technology or improving human behavior, the technology is always the better choice. And I 100% agree to this. Then quickly, some customer examples. Here in Finland, we have this Nova Hospital. It's in the center of Finland, opened 21. And the hybrid operation rooms is one of the most modern operating theaters in Europe. And here these so-called is equipped with the P-series sealing patient devices, providing disinfectant, blue light, then a white light, and the red and green lights. And the red and green lights are the lights that, for example, help the vascular surgeon to see better the operation area. Then Espoo Hospital here in the close to Helsinki area, they also have in their operation rooms, and then also they have these modular rooms that you can see in the picture are equipped with the disinfectant blue light. And then abroad, Dang Hon Institute in South Korea have installed blue light in their operation rooms. And then Mikkeli Central Hospital, they have this instrument maintenance facilities, so they have the sterile storage rooms that are equipped with the blue light disinfection, and there is the statement of the head of the sterile services department. And then also Docrotes Cancer Hospital, which is a private hospital here in Helsinki for cancer patients. So they have these modular rooms, also parts, meeting parts installed with the blue light. And then ambulances, especially in Germany, and then also here in Finland we have ambulance customers that are using blue light. And automatic and continuous disinfection in an ambulance it's not that easy, maybe that in a static area, but it should work like this, so that the blue light is on and the bacterial level stays on a certain level. When the patients are in transportation, the bacterial level or the microbe levels go up, and then when the car is not having the patient, or maybe on the garage, so then you can use the blue light in waiting. And but this is, I must say that I have been testing the ambulances with the blue light, and this works, but the only disadvantage is that the personnel is not always using the blue light even if they could. So that is one of the problems, and the blue light should be automatically on when the patient is not in. And here are some our OEM partners in the healthcare area. Halton takes care of the operating rooms and clean room ventilation, and they have installed also this integrated blue light in their systems. Profile Vehicles, an ambulance company here in Finland, have blue light in their patient compartment, and as well as Lindo. And if I remember correctly, so this is the aircraft patient transportation company. And then Plandent is having a portable device for dental clinic disinfection, and this has also found very efficient. We have been testing this device in practice in dentist clinic. And then this is for you to choose what kind of a hospital would you rather visit yourself. Thank you. And now I guess Karin will go to the questions and answers.
Yes, thank you, Kirsi, for this interesting presentation. So actually there are no questions in the chat at the moment, but everyone attending, so if you have questions after this, please feel free to write them in an email to us. I know that there are also quite some people from the German-speaking part of Europe. We do also have one in the personnel German-speaking, so if it's easier also to write in German, you can send an email also in German. So I think we will then go to the next slide. So thank you for joining us this autumn, and of course in this webinar today. Video recordings of the first 4 sessions are now already available at spectral.blue/webinars, and today's webinar will also be to be found here later on. So actually there is now one question in the chat, so I will go to that. And there is a question about spectral blue versus far UVC.
Well, that is a difficult.
That's a big question.
Yes, and quite difficult question for me also. So I'm not that familiar with the far UVC, and it has been on the market quite short time still. So it is not my expertise. Maybe is there any other person who can answer this question? Maybe Michelle, you could take the podium now. So thank you for my side.
Thank you, Kirsi.
And thank Kirsi. Yeah, I'm not trying to be a super expert on this either. I mean, far UV, as far as I remember, maximum is around 220 nanometers on that. And with the blue light, we are talking about, 405 and 450, mainly now with the multi-wavelength. The dangers of far UVC, I don't know. I mean, let's be fair about that. I mean, normal UVC is of course around 250, 254 nanometers, and we know that is very dangerous. But there is one, of course, enormous difference is that far UVC is not visible. So if you are using it, you need to have a method to test that it's working, especially if you would use LEDs. If it's LEDs, it's totally not visible, whereas ours is totally visible. So there is an add-on there to see if it's working or not, which you don't need with ours. But the safety part, I'm going to save to the experts who is working on that. I could, of course, mention something that we were one of the first companies in the world also working with regular UV LEDs, but we stopped that line last year because we see that the advantages are so much more within the blue light. But sorry, I couldn't give you a better answer on that. But of course, you can always email us more specific what comparison you would like to know, and we can put it forward to our R&D also. Yep.
Yes. Thank you, Michelle, for that answer. Yes, so I think this was the last slide we have, but please feel free to contact us, give us feedback, or also if there is something else that you would like us to keep a webinar on, or if you want us to have a Teams with you and your team, just be in contact with us and we are happy to connect. And if there are some customers here from Finland, I just want to say that if you want to see us or meet us, we will be at the Lab Quality Days in February in Helsinki. Thank you for today, and I wish everyone a very nice rest of the day. Thank you.